Is Achilles tendonitis ruining your training? Then watch this video. Hi, I'm Dr. Joe DeMarco, chiropractor and owner of OcraMed Health. I don't care whether you're a runner, a weightlifter, a soccer player, a basketball player, just a weekend warrior, Achilles tendonitis can ruin your training, ruin your fun. I treat a lot of people in my office for Achilles tendonitis, and I'm going to show you today how to fix it at home. But before we do, let's take a look at the anatomy. Let's take a look at the Achilles tendon. So as you can see here, the Achilles tendon is formed from the two major muscles of the calf, the gastrocnemius and the soleus. Now the gastrocnemius is the larger of the two calf muscles, and it's the only one of the two that actually crosses both the ankle joint and the knee joint. As you can see, it originates off of the femur. The lateral head originates off the lateral condyle of the femur, and the medial head of the gastrocnemius originates off the medial condyle of the femur. Then you have your soleus, which originates in two places. One is off the fibular head, and the second origin is off the medial border of the tibial shaft. Both of those muscles, the gastrocnemius and the soleus, as they come off their origin, come down and they form into the Achilles tendon, and then the Achilles tendon attaches to the posterior surface of the calcaneus, or what we would normally call the heel bone. All right, so there's the anatomy. So if you're currently suffering with Achilles tendonitis, you know exactly what I'm talking about. It is very painful. It hurts just to get out of bed in the morning, never mind going for a run or for a walk. You're getting a lot of pain in the back, lower part of the calf, along the Achilles tendon. It's usually very tender to the touch, and the pain goes right in towards the back of the heel. So let's go over a little bit what's causing it. When we understand what's causing it or why it's developed, then you can understand how we're going to fix it. So first off, there's two reasons why you're getting Achilles tendonitis, because there's two reasons why the Achilles tendon is getting aggravated or getting irritated on you. The first has to do with the muscles of the calf, the gastrocnemius and the soleus. So if we look at this band, this yellow part here, picture it as just the two calf muscles, the gastroc and the soleus, and how they converge down. And in this green area, if we think of this as the Achilles tendon, so these muscles are coming down, they converge, they form the Achilles tendon. Normally as we move, as we do things, these muscles of the calves should be stretching, they should be have elasticity to them. When this is taking place, the Achilles tendon is not being tugged on, it's not being irritated, you're not going to have Achilles tendonitis. However, wear and tear, fascial adhesions build up, and those muscles of the calf, the gastrocnemius, the soleus, will lose elasticity. And just as an illustration, I've tied some knots in the band now. So if you picture, once again, these are the calf muscles, but now these fascial adhesions have built up. We've lost elasticity. As you can see with these knots, there's less elasticity. This isn't stretching. What happens when the muscles of the calf is no longer elastic and no longer stretching? The Achilles tendon is going to start getting tugged on. And tendons do not like to be tugged on. You tug on a tendon, it's going to get inflamed, it's going to get painful. So that's reason number one, fascial adhesions in the muscles of the calf, the gastrocnemius and the soleus. So that's one thing that we're going to have to take care of. The second issue that happens with Achilles tendonitis is down in the Achilles area. There's also other muscles, and there's a lot of fascia down in that area. And a lot of times what will happen is the fascia will get adhesions down right along the Achilles tendon, and the tendon is no longer gliding along next to the other muscles, and there's friction down there. And that's another issue that we need to take care of. We need to make sure that the Achilles tendon is free and these other muscles down near the Achilles tendon are free to glide side by side along each other. So we're going to take care of both of those issues. I'm going to show you how to do it, so stay tuned. All right, so let's start working on this Achilles tendonitis problem. So as we mentioned, there's a couple reasons why the Achilles tendon is being irritated. We're going to start with problem number one first, the adhesions that built up in the gastroc and the soleus muscles that lose elasticity and start tugging on the tendon. So first off, what we want to do is we're going to get some blood flow into the muscles here. I want you to take some some coconut oil, some massage cream, nothing too greasy, and just get some of that massage cream or coconut oil on the calf or whatever you want to use. Like I said, don't use anything too greasy. And then just with your fist, put firm pressure down from the Achilles tendon in with your fist, and I want you to drag that fist right up the Achilles, up the calf muscles to the back of the knee. Just nice, smooth, firm strokes just like that. This is going to get a ton of blood flow in it. We're going to do the inside, the middle, the outside, just like I'm showing you, just nice and slow and firm. And two reasons we're doing that. One, as I said, get blood flow. Second reason we're doing that is as you come up, I want you to keep in mind where you're finding any fascial adhesions or any muscular knots in the muscle. And you'll know when you hit them, because what's going to happen is you go over these nice smooth muscles, you're going to hit like a bump in the road. It's going to be like you're coming up and it's going to be boom, boom, and you're going to feel it. You're going to feel a knot in there. It's probably going to be tender, but it may not be. And keep in mind where you found them, because we're going to come back to them and we're going to work them up. Now, how are we going to work out? We spent 3 or 4 minutes just dragging the knuckles up, getting some blood flow, finding those knots. How are we going to work them out? Foam rollers are much too big for this area. We're going to get in there with a massage ball. What massage ball we're going to use? You better believe it, a Tai Chi ball from OcraMed Health. These things are awesome. Look at the texture. We're going to get deep into that fascia with these things. Come back to where you found some of those knots. I want you to get the calf right on top of that Tai Chi ball, wherever those knots were, and start at whether it's 1 knot or you found 3 knots. Firm pressure down. Either use your hand, the weight of your leg, cross the other leg on top of it, whatever you need to get good pressure down. And I want you to spend 30 to 40 seconds back and forth, side to side, diagonal, and just mash up that knot in there. And then after you do that for 30 or 40 seconds, keep the pressure down on the ball, and I want you to just to point your toe and flex your foot back 10 times with the pressure on the ball. That's going to be stretching the muscles of the calf back and forth as you're holding pressure on the ball, and that's going to help break up the tissue too. So use the ball on any knots you found during that initial part when we were rubbing the knuckles up. And then, after you do that, we're going to just hit some general spots of the calf muscles to work some of the adhesions free. Now, you know, a big mistake that therapists make or people make when they work on these things also is you have Achilles tendonitis, so you're just working down near the Achilles. But the calf muscles, including especially the gastrocnemius, come all the way up here and cross the knee joint. Don't forget about this tissue. Adhesions all the way up here can tug on your Achilles and cause Achilles tendonitis. So don't forget that. And so what we're going to do is we're going to get on the medial aspect of the origin of the gastroc, which crosses the knee joint. It's on the end of the femur. And I'm going to spend about 30 seconds mashing there. Then I'm going to get to the lateral side. I'm going to spend about 30 seconds mashing there. And then I'm going to hit multiple spots along the upper gastroc, middle, get into the soleus down through here, and hit a good 6 or 8 different spots besides those knots, and just spend every spot that you decide to go on about 30 to 40 seconds where you're mashing it, and then 10 times where you're flexing the foot back and forth. And try to get inside and outside and middle. So just hit multiple spots. That's going to take care of the fascial adhesion part of Achilles tendonitis that we talked about, just to get some elasticity back and to break up some of those knots so that there's less tugging on the Achilles. Then the next issue we need to deal with is down on the Achilles, like we talked about. We want to make sure that Achilles is gliding freely in there. So we want to get in near the Achilles tendon now. And what we're going to do is we're going to actually take the point the toe like this and get that ball right along the Achilles tendon in there and hold firm pressure on it like this, and with both thumbs, and then flex the foot back up like this as far as you can. So I'm going to push down. The toe is pointed. I'm going to push down. I'm going to actually pull the ball slightly towards me. So I'm pushing in and pulling slightly towards me, and then I'm going to flex my foot back like this. And you're going to feel you're basically breaking up and moving that Achilles, letting it glide, and the ball's going to get in there, and if there's anything catching or gluing that Achilles together, you're going to free it up. So once again, you're getting in down near the Achilles. My toe is pointed. I got the ball on the side of the Achilles, kind of fitting it between the Achilles and some of the tissue here. I'm pressing down with my thumbs right into it, and then I'm going to pull my foot back. And I'm going to do that about 10 times on each spot, and then I'm going to move it down about an inch, and I'm going to press down and pull it towards me again, and then once again, flex the foot back 10 times. So I'm not behind the Achilles. I'm actually on the side of it where you can feel where the Achilles is and where there's like almost like a concavity, a little gap. That's where I'm putting the ball. I'm holding firm pressure. I'm pulling it towards me with the toe pointed. And once I lock it in the position, I'm going to flex the foot back 10 times. I'm going to do the inside, then I'm going to do the outside. And that's going to take care of breaking up any adhesions that's restricting the glide of the Achilles. So we're working, we broke up the adhesions in the muscles. Now we just freed up the Achilles. That's all you need to do to help this. Lots of ice, lots of rest, and it's going to get better. All right, so there you have it. I would recommend doing that work every other day. You want a day off in between so that the tissue that you're breaking down has a chance to recover and repair. Lots of ice in between, 20 minutes on, 20 minutes off. Give it a little time. Fascia release work. You're not going to get miracle results in one or two sessions, but give it some work. Give it some time. You're going to notice that Achilles tendon is going to have less tugging is going to be going on around that tendon, and your pain's going to slowly over days subside. All right, exercise programs, mobility plans, Tai Chi balls, our shock release instrument is all available on my website, www.OcraMedHealth.com. If you're enjoying these videos as much as I enjoy making them, please subscribe to my channel, OcraMed Health on YouTube. Questions about exercises or injuries, just leave a comment in the comment section below. I try to get back to everyone who writes in. And don't forget, OcraMed Health is here to keep you fit forever.